Okay, this is the SOAPE explanation part 2. So where we left off was this part 5, Pathophysiology and Anticipatory Guidance. So if you'll listen closely to this part, this is where a lot of students get confused. So you're going to do either Pathophysiology or Anticipatory Guidance for your SOAPE note. If your patient is presenting for a sick visit, you're seeing that patient for a sick encounter, then you're going to do the pathophysiology, okay? You're going to just tell us a little bit, few sentences about what is going on with that patient so that we know that you know the patho behind the patient's problems. So if they have COPD, you're going to tell us in a very few short sentences basically what COPD is. That's if they're being seen for a sick reason. Anticipatory guidance is for patients who are there for checkups, annual visits, employment physicals, established care, those types of visits. And so for anticipatory guidance, what I mean by that is for any female, what are some of the health maintenance things that you would recommend for them to have? Self-breast exams, mammograms either every year, every 3 years, depending on which research you lean toward. Pap smears, same way. For men over 55, what might you recommend? PSAs, colonoscopies, those types of things. So pathophysiology is if the patient is being seen because he or she is sick. Anticipatory guidance, a wellness visit, but you're going to tell them things that they need to think about doing as far as health maintenance, tests, or screenings to detect early problems. Section 6 is your assessment. This is where you give us your diagnosis. Now, we are okay with you using medical diagnoses, but you're going to give us either medical diagnoses or nursing diagnoses, and they need to be prioritized per your patient, what you're seeing, and what you're revealing to us in this SOAPE note. Along with those nursing diagnoses, you're going to give us goal statements for each nursing diagnosis. Now, I'm not telling you to come up with 10 diagnoses. 2 to 3 to 4 pertinent priority diagnoses is sufficient. Goal statements for each one of those. Remember, for a goal statement to be complete, it needs to be patient-driven, so patient will do something that is measurable and has an endpoint for evaluation and is realistic. So think of that when you're redoing those goal statements. It kind of takes you back a few semesters, but again, this is really good for you to review as you're getting ready to leave the program, okay, and to just refresh yourself on that. So that's the assessment part. For the plan part, if there was any medications given, and again, this depends on the type of the patient and the clinical setting that you were in, you're going to document what was ordered or given that day, and you're going to chart it in a legal fashion. So remember what I talked to you about immunizations. Need to have lot number and expiration dates documented, those types of things. Any diagnostic work done that you won't have results that day. So if you draw blood, if you do COVID screenings, if you do something like that and it's not the fast COVID screening where you'll know the answer that day, but it's going to have to be sent out to an external lab, you will list those. Any treatments done by you, if you're in the wound care clinic and you do a wound care, a wound dressing or a wound vac or something like that, you're going to list that there. So if you're not having those situations, you're going to put NA or none. Patient ed, okay? For those patients who were sick that you really want to do some teaching, right here's where this is going to come out, okay? So you need to put down any teaching that was done by you for your patient that's pertinent to what's going on. If they got new meds, we better see some teaching. If they got an immunization, we better see some teaching documented. If they have a new diagnosis, there better be some teaching, okay? So we need to see what type of education was given to the patient. Then you'll see that there's a consult and referral. There's a difference between these two. Consult is when you call someone of a different specialty and you get their input on the patient at that time. They're not necessarily seeing the patient, or it may be that they have a history of seeing the patient. But you, at that point, are getting some other provider's input into the care of that patient. Perhaps you're with a nurse practitioner and she's getting ready to change a med on a patient, and she wants to run it by the patient's cardiologist before doing so. So that would be documented here. Referral is when they're being sent out to someone. So if you're seeing a patient who has new onset cardiac issues and you're seeing them in a general primary care clinic, they're probably going to be referred to a cardiologist. So that's where you would write that here, is under this referral. Follow-up. We realize you may never ever see this patient again, but for this part, we want you to tell yourself that this is your patient and you're responsible for this patient's health care. And so that patient is you plan to see that patient again as a follow-up visit. What would you do next time? What would you ask about? Would you follow up on certain parts of their treatment plan that you did that day? And then this last part, we expect wholehearted, blatant, pour it all out honesty. You're going to go back and evaluate yourself and how well you did this SOAPE. The areas that you felt like you were really complete in, you were very direct in, you felt good about, and those areas that you didn't feel good about, that you really wish that you had gone back and gotten more information. Likewise, throughout this whole SOAPE, remember I told you, at any point, they leave the room and you think, I should have asked them this. In a different colored font or something, say, I wish I had asked this information because it was important because of this. Okay, so you need to tell us what you're thinking. We need to see your mind working on paper on this SOAPE note. Okay, so that is it's 2 videos explaining the SOAPE note. So hopefully that you've looked at both of these and listened to both of these and you have some ideas. Again, please feel free to write down any questions you have and we'll go over those for the Q&A Zoom.